How to plan for healthcare and medical expenses after divorce. Hi, I'm Tim Blankenship with Divorce661.com. One of the most overlooked parts of divorce planning is healthcare. Whether you are on your spouse's insurance or managing shared medical costs for your children, your situation likely changes after divorce. Let's talk about how to plan for healthcare and medical expenses so you stay protected and financially prepared. First, if you are covered under your spouse's employer-sponsored health plan, you'll typically lose that coverage once the divorce is finalized. You'll need to secure your own health insurance, either through your employer, a state exchange like Covered California, or COBRA coverage. COBRA lets you stay on your ex's plan temporarily, but it can be expensive since you'll pay the full premium. Next, update your budget to reflect new medical costs. That includes premiums, copays, prescriptions, and any out-of-pocket expenses. It's also important to make sure your divorce agreement spells out who will cover the children's health insurance and how unreimbursed expenses like dental, vision, or therapy will be split. These details should be clearly documented to avoid confusion later. We worked with a client who didn't realize she would lose coverage the day her divorce was finalized. She went without insurance for 2 months before we helped her get enrolled in a new plan and updated her judgment to include clear language on shared medical costs for her kids. At Divorce 661, we help you plan for the real-life aftermath of divorce, including healthcare. We'll walk you through what needs to be updated, what coverage options are available, and how to make sure medical expenses for you and your children are fairly handled. If you're unsure about your healthcare situation after divorce, visit Divorce661.com and schedule a free consultation. We'll help you find the right insurance, update your agreements, and protect both your health and your finances moving forward.